As I was discussing about the contraindication of 5-glutathione, so they're contraindicated in infection, cancer of bladder, low blood glucose, hypoglycemia, chronic heart failure, severe heart failure, sudden and serious symptom of heart failure, acute decompensated heart failures, liver problem, and bloody urine. So this drug is contraindicated. These are the side effects which is reported after administration of 5-glutazones. So these are the side effects of 5-glutazones. Swelling may be occur, edema when used in a combination with sulfonylurea or insulin. Whenever there is low blood sugar level, when the glucose concentration in the blood become low, upper respiratory tract infection. These are also the side effects which are reported here. There may be chances of headache, heart failure, sinus infection, fracture of bone, sore throat, pharyngitis, inflammation of the pharynx. Now these are the doses. 5-glutazone treatment may be initiated at 15 mg or 30 mg once daily. The dose may be increased in increment up to 45 mg once daily in combination with insulin. The correct insulin dose can be continued upon initiation of 5-glutazone therapy. Now come toward the fifth one, the fifth drug that is called sitagliptin. So sitagliptin, it belongs to dipeptidyls, peptidase 4 inhibitors. So sitagliptin, this is the drug which is also used in the treatment of diabetes mellitus. Its main mode of action or mechanism of action is sitagliptins as a DPP4 inhibitors, which is believed to exert its action in the patient with type 2 diabetes by slowing the inactivation of incretin hormones. The concentration of active intact hormone, they are increased by this drug, thereby increasing and prolonging the action of these hormone. So actually sitagliptin, these are dipeptidyls peptidase 4 inhibitors, so it can inhibit actually there are certain hormones. So these drugs, whenever after administration of sitagliptin, so it can directly block or inhibit the dipeptidyls peptidase 4 enzyme, which is believed to exert its action in the patient with which type 2 inhibitor by slowing the inactivation of incretin hormone. So it means that there are particular hormone which are responsible for the activations. So whenever this drug is administered, so this drug can directly block the activity or inhibit the activity of that enzyme, and the concentration of the active intact hormone, they are increased by the drug, thereby increasing and prolonging the action of these hormones. The clinical uses of sitagliptin is it can control the high blood sugar in order to prevent the kidney damage. So they are also used in the treatment of blindness, so as well as they are used in the treatment of nerve problem, loss of limbs, and sexual functional problems. Sitagliptins, they are also contraindicated in anaphylaxis, urticaria, skin rashes, angioedema, swelling at the areas of the mucous membrane, especially at your mouth, cavities, dermatitis, or other serious skin infection, serious rash, Steven-Johnson syndrome. So they are contraindicated in these conditions. It is a rare disorder of the skin and mucous membrane. Dosage form and strengths of the sitagliptin. So sitagliptin, they are available in tablet form, 25 mg, 50 mg, 100 mg. Especially in type 2 diabetes mellitus, they are available in 100 mg per oral q-day. And dosage modification in case of renal impairment, sitagliptin can be recommended if the creatinine clearance is greater than 15 ml per minute. Then dose adjustment is not necessary if the creatinine clearance is 30 to 50 ml per minute. Then 50 mg per orals. day. If the creatinine clearance that is less than 30 ml per minute, then 25 milligram per oral q-day. ESRD, end stage renal disease, in this case 25 milligram per oral q-day, regardless of the hemodialysis. The sixth one, the final, that is called Acarbose. Acarbose is also belong to A Glucosidase inhibitor. The mechanism of action, its mode of action is Acarbose inhibit the enzymes glycoside hydrolases. It is needed, this enzyme is needed to digest the carbohydrates, specifically alpha glucosidase enzyme in the brush border of the small intestine in pancreatic alpha amylase. So this is very clear that acarbose, it can actually, that acarbose is responsible for the inhibition. ये क्या करता है acarbose, असल में ये ग्लाइकोसाइड हाइड्रोलाइजेज जो है ये एक एंजाइम का नाम है, उसकी एक्टिविटी को इनहिबिट करता है और इस एंजाइम का काम ये होता है कि ये रिक्वायर्ड होता है, ये ये रिक्वायर्ड होता है टू डाइजेस्ट ए कार्बोहाइड्रेट को डाइजेस्ट करता है, स्पेसिफिकली अल्फा ग्लूकोसाइडेज एंजाइम इन द ब्रश बॉर्डर ऑफ द स्मॉल इंटेस्टाइन्स एंड pancreatic alpha amylase. Inhibition of these enzyme system reduces the rate of digestion of the complex carbohydrates. So definitely when the activity of these enzymes are inhibited or reduced, so it will reduce the rate of digestion of the complex carbohydrate. Now these are the contraindications. So glucosidase inhibitor or acarbose. So they are contraindicated. It cannot be used. Acarbose is contraindicated in a patient with inflammatory bowel disease or for, let's suppose, if colonic ulcerations, colons, when there is ulcerations of the colon or ileus or partial or susceptibility to GIT, gastrointestinal obstruction or GI disease involving disease of absorption or digestion. So it means that these drugs acarbose, they are restricted, so acarbose cannot be given in such a condition if the patient who has a problem of inflammatory bowel disease or these are the diseases which are given here. So in these cases it cannot be recommended. These are the side effects of acarbose which are reported here. The sign of the allergic reaction, which include difficulty breathing, swelling of the lips, face, tongue or throat, severe itching and severe stomach pain, and there may be severe constipations, diarrhea, that's watery or bloody, unusual bleeding, easy bruisings may be occurs, and you can say purple or red pinpoint spots under your skin may be occurs. So yellowish colorations, bruisings easy. The dose is typical starting dose at 25 milligram taken 3 times per day with the first bite of each main meal, and this dosage may be increased up to 100 milligram taken 3 times per day with the first bite of each main meals. Now the combination of insulin and oral hypoglycemic agent. So if we combine insulin, if we can, let's suppose if it can be recommended, or you can say if they are combined, if insulin is combined with the oral hypoglycemic agent, so what will be occurs, what will be happens by adding the oral agents to the insulin, it could reduce the required insulin dose and thus decrease these insulin related side effects. So the side effect of the insulin will be reduced. However, there could be other side effects related to specific to various oral blood glucose lowering drugs. So as we have discussed about different एंटी-डायबिटिक ड्रग्स, सो ऑलमोस्ट जितने भी ड्रग्स हमने डिस्कस किए, तकरीबन सारे ड्रग जो इनकी मैकेनिज्म ऑफ एक्शन, मोड ऑफ एक्शन तकरीबन एक ही है, थोड़ा बहुत इसमें फ़र्क है, लेकिन प्लीज़ काइंडली आप इसको रिव्यू कर ले, फिर अगर इंशाल्लाह अगर कोई मसला इसमें तो फिर आप मुझसे पूछ सकते हैं। इसमें मेरा ईमेल भी है, तो आप मुझसे डायरेक्टली भी कांटेक्ट कर सकते हैं, ठीक है। तो inshallah in my next lectures I will talk about the nursing interventions, especially when we are going to treat diabetic patient with the help of orals anti-diabetic drug. Thank you so much for watching my lecture.